Hi, welcome to my YouTube channel, Orthodontics by Dr. Kieran Daly. Today we're going to talk about the repositioning of upper incisor teeth using fixed or train track braces, the extraction of teeth, and also the use of a hybrid appliance. We're going to show you the case of Abby, who presented at about 13 years of age. And you can see on Abby's photographs and x-ray that she had quite prominent upper front teeth. This is often referred to as an increased overjet. Abby's overjet was a result of a mild lack of growth and projection in her lower jaw. This had allowed her lower lip to get behind her upper front teeth or upper incisors, and her upper front teeth or incisors had become too prominent. This is often the most common reason for increased overjets in teenage patients. The correction of the prominent upper front teeth involved, first of all, making a decision as how best to reposition them back inside the protection of her lower lip or bottom lip. You can see on Abby's OPG x-ray that she has a very heavily filled molar tooth in the upper left side. So following a discussion with Abby and her parents, it was agreed that we would extract this tooth on her left side as well as the first premolar tooth on the right side. In order to guarantee that we can reposition Abby's front teeth into the correct position, we need to use an anchor to prevent the upper molar teeth slipping forward as we reposition the front teeth. Modern technology has allowed us to use a new technique which we describe as the use of a hybrid appliance. The hybrid appliance involves using 3D technology to carefully plan the placement of two very small temporary orthodontic implants about 1 centimeter behind the upper front teeth. 3D technology allows us to create a guide that we use to place the implants. First of all, in the laboratory, in a model of Abby's teeth, and then using the same guide, eventually we place the temporary implants behind her upper front teeth. We attach to these implants the hybrid appliance, which has small silver rings that fit on the molar teeth at the back, and it's also anchored to the implants at the front. This now provides the anchor that we need so that we can carefully calibrate and then reposition the upper front teeth into exactly the correct position. You can see on Abby's x-rays and photographs how we use the hybrid appliance to reposition her teeth, and this was carried out in a period of about 9 to 12 months. Once her upper front teeth were in the correct position inside the protection of her upper lip, as well as sitting or resting on the lower incisors, we were left with a small amount of residual space where the heavily filled molar tooth was removed. The hybrid appliance is an excellent way then to close this space by running what we call power chain on the inside, and that allows us to bring these large molar teeth forward, closing the space in a very short period of time. So one of the major advantages of using an appliance like a hybrid appliance is that it allows for space closure in a much more controlled manner, and also significantly reduces the treatment times for these patients. In Abby's case, all of her treatment was carried out in less than 2 years. You can see in her final photographs, all of the space has been closed. She has a perfect fit of her teeth or bite, what we call her occlusion, and you can see that she has excellent both dental and smile as well as facial aesthetics. And Abby is a very happy patient in her final photographs.